Hi everyone. Today we're going to talk about simulation in healthcare. Simulation in healthcare is a variety of activities that share similar or broad purposes of improving efficiency, effectiveness, and safety of healthcare services. Each of these purposes can be achieved by role play, a variety of situations from realistic full mission to tabletop activities, and high and low tech tools. Human behavior in true-to-life settings in which professionals operate can be understood better through simulation. The thing that links all these activities together is the act of representing or imitating some process or situation from complex to very simple. In this session, we will discuss simulation and its relevance to healthcare informatics, ethical issues, laws associated with simulation, the impact of simulation on healthcare delivery, administration, education, research, how data capture tools and technology is used in simulation, and specific examples of simulation in healthcare. Simulation refers to a mock representation of real-world activities to achieve educational goals through experience and observation learning. Although simulation in healthcare is fairly new, it has been used in other high-risk professions for a long time, such as aviation. Tools used in simulation serve as a replacement to live patients. Simulation helps professionals learn from their mistakes without harming a patient. There are different classification and types of simulators, such as simulation-based learning and medical simulation. Simulation-based learning costs a lot, but can be cost-effective if used correctly. At the postgraduate and undergraduate levels, medical simulation has enhanced clinical competence. It also has many advantages that can lower healthcare costs and improve patient safety through the improved competencies of healthcare providers. Simulation is relative to health informatics because it introduces new ways of thinking about informatics in healthcare. Simulation also provides tools to better understand and insight into complex processes and systems. It has a lot of potential applications in healthcare informatics, including evaluation, education, and research, training, and policy making. For example, it can help to train people on the EHR system by entering in a mock patient information like lab work results, doctor orders, and medication. By entering this kind of information, the application is able to detect mistakes and teach proper use of the EHR system. There are 3 ethical requirements in medical simulation that are: keep learners, patients, and faculty safe, facilitate engaged learning, and prevent errors. The safety of all participants is important, whether it is physical or psychological. A physical risk could come from faulty equipment. It is important to have safety not only for the patient, but for the individual involved in stimulation, including faculty and staff. Psychological effects of simulation on learners needs to be considered by anyone that has a role in simulation and be responsible to themselves, learners, patients, and families. Simulation can be stressful to the learner. An example of a psychological risk could come from a simulation where a simulated patient dies, or the simulation causes a clinician to challenge the decision of a senior physician that is actually played by a senior physician. These kinds of simulation can challenge the emotion of the learner. A technician has to know when and how much challenging scenarios are appropriate or ill-advised, and what deception is applicable in learning and patient safety. In the environment of simulation, it should be a safe place to learn and make mistakes. In heightening the awareness of a situation and making an impact, some stress is good, so that if the learner experiences a similar situation, they can handle the situation effectively and efficiently. Learners should be pre-briefed and debriefed. Pre-briefs should occur prior to the simulation activity about the equipment, environment, and objectives that will be used in the session. Debriefing is just as important as the simulation for learning and must be done. This allows the simulation team time to identify what worked and what changes need to be made before the next simulation. Simulation does not serve just the technical aspects of healthcare, but also can be used for education in ethics and professionalism. When conducting simulation, faculty still has to follow the same laws that apply to other areas of healthcare. For example, if you are doing a research simulation, then you have to get the participators' consent and follow the same laws for research. If the simulation requires collection of personal information, then all the privacy and confidentiality laws like HIPAA fall into place. Simulation is in place to better healthcare by providing a safe, interactive environment for the participants. Simulation learning has an impact on healthcare by helping healthcare professionals develop skills, knowledge, and attitudes while protecting patients from unnecessary harm. Education through simulation can provide valuable tools in learning to resolve practical dilemmas and alleviate ethical tension. Simulation training tools, techniques, and strategies can be used in making structured learning experiences and also help with teamwork, competencies, and learning objectives. Simulation training has proven to be very impactful on the administration of medication. A research done to compare medication errors made before simulation and after simulation showed that the simulation helped to reduce errors. 880 doses were administered. There were 30.8% of administered medication errors made before simulation and 4% made after. Administration simulation provides significant advantages to patients' care and improved outcome. Simulation has impacted education and how a learner learns information. Interactive techniques have shown to have positive effects on the overall learning experience for the learner. Learners retain more information and learning skills with simulation than the passive absorption of the lecture. Simulation education is a bridge between classroom learning and clinical life, real-life experiences. Simulation is impacted by research through knowledge learned from research. For example, research can determine how well a simulation is helping in a particular area of healthcare. Does the simulation practice need to be changed, or is there an area that can be improved? It can help improve the quality and safety of healthcare by its findings. Simulation can use captured data to help participants improve on their scores, to improve the simulation application, or for other data collection to be analyzed. Video cameras or other devices can be used to capture procedures, demonstration, and skills needed in healthcare so learners can learn from seeing the technique without actually being there. All kinds of technology is used in simulation in healthcare. Two kinds are anatomic parts of the human body and mannequins. Anatomic parts of the human body are used to practice skills such as inserting a urinary catheter, attaching a heart monitor, and giving an injection. Full body mannequins, there are two kinds. One does not respond to any intervention, and the other, which is computerized, realistically responds to user intervention. There are 5 different types of simulation models that are used in simulation programs for healthcare: task trainer simulation, standardized patient simulation, tissue-based simulation, mannequin-based simulation, and virtual reality simulation. Task trainer simulation, students practice scenarios with a trained professional by role-playing scripted situations and practice skills to ensure patient safety, interaction, and comfort. Standardized patient simulation enables interactive teaching through the combination of patient, actors, and technology. Tissue-based simulation, learners move from dry lab tasks as they advance in their learning to a wet lab experience, and it helps learners to practice procedural skills out of clinical environment. Mannequin-based simulation has 3 levels of fidelity, which are low, medium, and high. The level of vitality depends on the technical ability of the mannequin. They are used for skilled training such as vital signs, chest compression, and other skills. Virtual reality helps students, faculty, and medical providers learn using leading-edge tools to adapt and investigate medical training advancements. Simulation has been used in healthcare education for a long time, but has really advanced in the last couple of decades. As it moves forward, it thrives to achieve safer and better quality of care for patients. As we discussed in this session about simulation and its relevance to healthcare informatics, ethical issues, laws associated with simulation, the impact of simulation on healthcare delivery, administration, education, and research, how data captures tools and technology is used in simulation, and specific examples of simulation in healthcare, we can see the impact simulation has on healthcare and the ability healthcare professionals have to meet patients' needs safely. Thank you.